Let us now consider the microscopic features of blood vessels. I am grateful to Professor Michael Horsch of University of Michigan Medical School for providing the images of histology sections used in this video. From the heart, the large elastic arteries or conducting vessels arise. They successively branch to give rise to medium-sized muscular arteries or distributing vessels, small arteries and arterioles or the resistance vessels, and capillaries and sinusoids or the exchange vessels. These capillaries or sinusoids join together to form venules and successively small and large veins which form the capacitance vessels which drain blood back to heart. The wall of the blood vessels show three layers from inside outwards. They are tunica intima, tunica media, and tunica adventitia. Tunica intima contains simple squamous endothelium on basement membrane. These endothelial cells help in diffusion and secretion of various factors, and they contain vibral palate bodies and pinocytic vesicles. Beneath the endothelium, we have subendothelial connective tissue or lamina propria, which consists of fibrocollagenous matrix, fibroblasts, and myointimal cells which are involved in atherosclerosis. Tunica media is the thickest layer in arteries. It extends from internal elastic lamina to external elastic lamina. It contains circumferentially arranged elastic lamellae in elastic arteries, or smooth muscle fibers in muscular arteries, or cardiac muscle in pulmonary veins, in addition to type 3 collagen fibrils, elastic fibers, and ground substance. Tunica adventitia is the thickest layer in veins. It's made up of general connective tissue. In this layer, type 1 collagen fibers, elastin fibers, and smooth muscle fibers are arranged in a longitudinal fashion. In addition, this layer also contains vasa vasorum and nervi vasorum. These are the blood vessels and autonomic nerves which supply the wall of the blood vessel. Let us now look into the features of large elastic artery. The large elastic artery include aorta and its main branches, that is brachiocephalic, common carotid and subclavian arteries, and common iliac arteries, as well as pulmonary arteries. Elastic artery shows the same three layers of the blood vessel, that is tunica intima, tunica media, and tunica adventitia. Tunica media contains elastic lamellae, hence these arteries are called as elastic arteries. Tunica intima contains endothelium and well-developed subendothelial connective tissue with myointimal cells. Tunica media is the thickest layer, and tunica adventitia contains collagen, elastin, fibroblasts and macrophages, vasa vasorum, nervi vasorum, and lymphatics. In case of these large elastic arteries, the tunica media contains 40 to 70 concentric elastic lamellae or fenestrated sheets of elastic fibers. These appear as refractile eosinophilic wavy lines in routine H&E sections. Because of these elastic lamellae, the internal and external elastic laminae are inconspicuous. In addition, the media also contains smooth muscle fibers, collagen, and ground substance, but it has no fibroblasts. Let us now look into the features of medium-sized muscular artery. The medium-sized muscular artery include brachial artery, radial artery, or ulnar artery, or any other artery of a similar size. These medium-sized muscular arteries have smooth muscle fibers in their tunica media, hence they are called as muscular arteries. The smooth muscle in its tunica media not only helps in regulating the blood flow, but also helps in secreting collagen, elastin, and ground substance of the tunica media, and also in repairing tunica intima. It has thinner tunica intima compared to the large artery, a very prominent internal elastic lamina, which is its characteristic feature. Media contains smooth muscle fibers, collagen, elastin, and ground substance, Again, it has no fibroblasts and a recognizable external elastic lamina. Tunica adventitia contains collagen, elastin, fibroblasts, macrophages, occasional adipose tissue, vasa vasorum and nervi vasorum. This tunica adventitia blends with the surrounding connective tissue. Let's look into the features of resistance vessels. The small artery shows well-defined internal elastic lamina and up to 8 layers of smooth muscle fibers in its tunica media, whereas the arterioles show only 1 to 2 layers of smooth muscle in tunica media, and their internal elastic lamina may or may not be present. In case of capillaries, they are lined by endothelium on basement membrane and they lack the typical 3 layers in their walls. There are 3 types of capillaries. The continuous capillaries are seen in muscles, lung and central nervous system. They are showing endothelium which have occluding junctions with adjacent cells. Pericytes are present outside the basement membrane and they permit passage of only small molecules. The second type of capillaries are the fenestrated capillaries. These are found in endocrine glands, gallbladder, kidney and intestine. They show fenestrated endothelium and they permit passage of larger molecules. The third type of capillaries are the discontinuous capillaries or sinusoids. They are found in liver, spleen and bone marrow. Here, basal lamina is partially or completely absent and there are large gaps between the endothelial cells. So these sinusoids permit passage of large molecules as well as blood cells. They are associated with Kupffer cells and Ito cells in liver, and the endothelial cells are modified to form stave cells in spleen. Let us now look into the features of large vein. The large vein include superior and inferior vena cava, pulmonary, portal and subclavian veins. The large vein shows 3 tunics, but they are not distinct, and tunica adventitia is the thickest layer. When we compare the vein with the accompanying artery, veins have thinner wall and irregular, larger lumen. In case of large vein, the tunica intima shows endothelium with subendothelial connective tissue layer. Tunica media is thinner and contains circumferential smooth muscle, collagen and fibroblasts. Tunica adventitia is the thickest layer containing collagen, elastin and fibroblast along with longitudinally running smooth muscle fiber bundles. So let us quickly recall what we have seen so far. Walls of the blood vessels have 3 layers from inside outwards: tunica intima, tunica media and tunica adventitia. Tunica intima consists of endothelium and subendothelial connective tissue. Tunica media is the thickest layer in arteries. It is made up of circumferential smooth muscle in case of medium-sized arteries or elastic lamellae in case of large arteries, along with collagen and ground substance. Tunica adventitia is the thickest layer in case of veins, and it consists of connective tissue, vasa vasorum, nervi vasorum. In case of large veins, longitudinally running smooth muscle is also found in this layer. Thank you. Hope you enjoyed this video. You can also visit this site for similar histology videos.